And welcome to our town hall meeting on mass shootings. Can you all hear me okay? Our sound is working? Good, good. I'm Barbara Lee Van Horsen. I'm the experimenter at the Momentum Center, which is a grassroots movement to create a stigma-free community. Some of you have attended town hall meetings in the past. Town hall meetings kind of inform the work of our mental illness task force. And then the Mental Illness Task Force also identifies topics to talk about at our town halls. And so I just wanted to do a quick overview of some of the things that task force has accomplished, including community trainings. We do QPR and mental health first aid trainings. Tonight I want to especially recognize Sarah Lewakowski and Mosaic Counseling for providing the QPR training tonight. Really appreciate that. If you have need of those trainings at your workplace, your church community, any other place that you reside, let us know. We also run support groups. There's a family support group for people who have mental illness, and there's a support group for people who have lost a loved one due to addiction, whether that was accidental, intentional, or because of other medical complications. And we also run a couple of SMART recovery groups, which is non-faith-based recovery from any kind of addiction. All three of those came out of the requests of people who've attended town hall meetings in the past. Opening the Momentum Center, which is social and recreational programming for people with mental illness, addictions, and disabilities, came because of town hall meeting conversations, including the fact that we expanded that to include teenagers a year ago, and then in May added 11 and 12-year-olds. We had our Salmon Run to erase stigma, an awareness-raising event to get rid of stigma on Saturday. We are hosting an awareness event at Lakeshore Middle School the end of October about increasing diversity and decreasing anxiety. All of those things have come from these conversations. And we have 2 new town halls in the works. We are likely going to be talking about teenagers in November, and in April talking about the intersection of mental illness and prison. So look for announcements on those. If you haven't been to a town hall before, this is how our agenda works. We do some welcome and introductions. Then we hear from our esteemed panelists. Then we go to Q&A and comments. Then we have our panelists join the tables for small group conversation and then large group brainstorming. So the whole intention of this time together is to become informed, but also to put together our ideas, our thoughts, our creativity, to come up with suggestions for what we can do as a community to address, in this case, mass shootings. And when we see gaps in resources in our community, to bring that information to the organizations working to fill those gaps. And if nobody's working to do it, to bring it back to the Mental Illness Task Force and figure out how we can address those issues. I want to introduce our panelists for tonight. We have, so I'm going to introduce our panelists, then I'm going to thank sponsors and say a few other things, and then they'll start talking. But we have such a great slate tonight. We have Bob Vandepoel, who is from Pine Rest Employee Assistance Program. He formerly served as the president of the Crisis Care Network, the world's largest provider of crisis response services to the workplace. He's led teams to mass violence events such as 9/11, Virginia Tech, Aurora, Sandy Hook, the Boston Marathon, and Kalamazoo. So welcome, Bob. We have Joellen Rindress with us. She is a psychological first aid specialist at Health West and leads a team that responds to traumatic events. She represents mental health on the executive board for the Region 6 Healthcare Coalition, which is a 13-county emergency preparedness organization. She's a disaster mental health responder and an instructor for the Red Cross, and she's responded to many gun violence-related deaths, including the Dayton Massacre. So welcome, Joellen. Sarah Lewakowski is here, the executive director of Mosaic Counseling, formerly TCM. Their mission is to offer hope and healing for all by providing accessible and affordable professional counseling services. They never turn anyone away. And Sarah will speak to us about the impact of these shootings on our own mental health. Welcome, Sarah. We also have Dr. Gina Ramirez with us. She is a pediatrician and a member of the Grand Rapids chapter of Moms Demand Action. Her expertise is in general pediatrics, and gun violence prevention is something she's personally passionate about, especially as it relates to children and women. She also serves as a board member at Every Woman's Place in Muskegon. So welcome, Gina. Gabby Easterly is also with us tonight. She's a student at Spring Lake High School, and as a student, she is affected by the news of mass shootings and our response to them, including participation in mass shooting drills at school. So she'll talk to us about those effects on her well-being and the effect on her colleagues. Welcome, Gabby. Mike Rohr is with us, the Assistant Superintendent at Ottawa Area ISD. He brings broad school expertise related to how local districts across Ottawa and Allegan counties are planning and preparing for mass shootings. And he's the chairperson for the Ottawa Area Secure Schools Network. Welcome, Mike. Sergeant Chris Kostner from Ottawa County provides active shooter training in our county and will speak to the evolving understanding and response of law enforcement to mass violence incidences. Welcome, Chris. And finally, Sheriff Steve Kemper is on the way. He is with Ottawa County. He apologizes that he is late, but will be arriving as soon as he completes another obligation in our county. So we'll look forward to Steve joining us as well. Want to mention our sponsors: Ottawa County, North Ottawa Community Health System, Grand Haven Area Public Schools, and the City of Grand Haven. We couldn't do this without their support and their sponsorship. So thank you to our sponsors. And our refreshments in the back today are provided by Aldea Coffee and Just Goods Gifts and Cafe. So thank you, Aldea and Just Goods. So it was just after the two most recent mass shootings. As you might recall, we were wrapping up our celebration of Coast Guard Festival about that time, when I was approached pretty quickly by people in our community asking if we couldn't convene a conversation on this topic. And given that the total number of deadly mass shootings in the United States in 2019 averages 1 every 13 days, yes, we need to have this conversation. With discussions of shooting and mental illness taking place across the nation, the Mental Illness Task Force believes that it is really critical that we clarify the difference between mental illness and mental health, so there isn't more stigma created surrounding people who struggle with legitimate mental illnesses that do not normally include expressions of violence, while also addressing the kind of mental health issues that surround these horrific events. Arthur Evans, CEO of the American Psychological Association, says that calling every mass shooting a mental health problem is inaccurate and is stigmatizing. Evans urges us to look at a whole host of contributing factors, including hate, bigotry, and access to assault weapons. Now, at the same time, we do have to address the fact that we do have many people struggling with mental health issues that are not getting the services they need. And we all have to manage the effects on our own mental health, the mental health of our children, our society's mental health, as these tragedies continue to impact our own sense of safety and security. Finally, so many of us are trying to figure out what we can do. When we come together, we find strength, community, creativity, and wisdom. And in that process, we also hope to find steps we can all take to creating a more peaceful and loving world. Now, whenever we get together for community conversations, we have a set of ground rules that we review. So I need to go over those. The first one is honesty. We don't get together to debate who's right and who's wrong. We get together to have honest and genuine conversations about what we think, what we experience, what we feel, and to be willing to listen to the honest experience of other people. We are equal and valuable contributors to this conversation. Yes, we have an amazing panel of experts with us, but all of us are involved in this, and all of us have an equal opportunity to give our opinions, to express our views, and to be valued for our thoughts and contributions. Respect. We all have preconceived ideas, and they can get in the way of our listening to each other. So we want to be aware of that so we can remain respectful of each other and ourselves throughout the evening. We want to practice active listening. Often our minds are racing in a lot of other directions, most often what we want to say. So I'm going to challenge us to listen to what's being said and give speakers our full attention when they're talking. And responsibility. All of us have triggers that can be set off unintentionally by other people. We all have hot buttons. If that happens, we want to be able to name it without blaming anybody else for it, owning what we say, what we feel, how we react. And finally, this is a shame-free zone. Shame never changes anything. It never leads to positive, constructive outcomes. Shame just pushes things deeper down inside where they can continue to fester. So we want to provide a safe place for people to express themselves without being shamed. Now, I need to know if everybody in the room is willing to cooperate with these ground rules. Is there anybody here who will not cooperate with these ground rules? Wonderful. Then we can have this conversation. So with that, I would like to begin with Bob Vandepoel. Each of our speakers will have up to 10 minutes to speak. They'll all speak, and then we'll have a question and answer period where you can ask any of the panelists your questions. You can also go to the mic for comment. And so we'll do that after they each speak. Bob.
Good evening. So I was asked to talk about mental illness as being the cause or not the cause of this kind of violence. Deep, clinically significant sigh. So have you ever noticed that when we're shocked, we all get dumber? When we're shocked, we all get dumber. And when a mass shooting takes place, it shocks all of us because it breaks every rule we've ever heard from the second we were born. Probably prenatally. Every message, every single effort that was made was to produce health and growth and safety. And so from my grandmother, I heard many